Hey there, everyone. Welcome back to another episode of the Growth Room podcast, where we dive into all the facets of healthcare with experts who are leading the industry. Please join me in welcoming Ellington Jones, the Chief Administrative Officer at UC San Diego Health. Thank you so much, and we appreciate you for joining us, Ellington. Can you please tell us about yourself and what you do at UC San Diego Health?
Absolutely. Thanks, Sal. Thanks for having me. It's good to be on. Um, so my name's Ellington. I currently the CAO, Chief Administrative Officer for Surgical Specialties at UC San Diego Health. UC San Diego Health is a academic medical center, part of the University of California Health System. There's 5 other academic medical centers that are part of the system throughout the state. Um, we have about 1,100 beds. We span now 3 campuses. In December of 2023, we added a third campus. And we've topped over about 1.4 million ambulatory visits, both ambulatory visits and surgeries this past year. So it's a pretty robust system. Um, my expertise revolves around service line operations, service line development, hospital operations, and strategy. Have about 10 years of executive experience from nonprofit, for-profit, now academic medical centers, enhancing service offerings to patients, improving service line throughput, expanding access to care, things like that. I'm really passionate about improving the health of communities. And I found a unique joy in academic medical centers. We partner and get the opportunity to work with physician scientists who really push the boundaries of what's possible in healthcare. And that's just something that motivates me every single day when I go to work.
Oh, that's awesome. So, what's your workflow like? What's it like to be Ellington for a day?
Man, I love that question. It's incredibly varied. I probably start every morning with looking at operational data, like how are we doing today in some areas of opportunity that we identified maybe the year before, and we made it a goal for this year, or maybe there's something that's pressing that we just need to monitor for in the near term. Then I'll move into our daily huddle system, which is, we call it DES, daily engagement system. Every hospital has sort of some sort of huddle system that they've implemented to kind of just increase communication about what's going on throughout the system. Um, and that also entails looking at data and reporting out progress. It's sort of like, almost acquainted to, if you're a coach, looking at game film, just trying to see what are the trends and what are the areas of improvement. Then I will probably go into more strategic meetings, sort of middle to the end of the day, with department chairs. Uh, Maybe I'll have a site visit scheduled with one of our um, surgical clinics. We have about 52 clinics around San Diego that are within surgical specialties here at UCSD. Um, I do spend time with physician recruitment, participating in interviews for future faculty members. That's always really great. They have a lot of great questions about the system and what it's like to work at UCSD. Yeah, it's a fast-paced, challenging role, but it's very very rewarding. Nothing is the same on any 2 consecutive days. I could tell you that.
Super, super interesting. So, how critical is technology in your day-to-day processes? What processes, tools, or tech do you rely on to perform optimally?
Oh man. Well, I can tell you right now that technology is, it's we almost just don't even think about that question because technology is so ingrained into everything that we do on a day-to-day basis. I'll say that from a reliance standpoint right now, administrators rely very heavily on our analytics platforms, data analytics platforms to track key metrics throughout the system, whether it's patient access, clinic utilization, surgical outcomes, employee engagement, and wellness is a really big one. Using our electronic health record, we're an Epic shop, so Epic and Cerner tend to be the two leading electronic health records across the industry. We happen to have Epic. Mining that platform is crucial for managing patient information that's relevant for the day ahead, and care coordination. One of the other tools that is probably really important that we use is Tableau, which is a software that is used to help visualize a lot of information. I mean, we're that quote, we're drowning in information, but starved for knowledge, So every single week there's a slew of new fun Tableau dashboards that our analytics team tend to put together to tell a different story about the conditions we're treating, the conditions we're not treating, which is also a critical part of my role, is trying to see how we can complement existing services with future services that are in demand for patients. And then also just the day-to-day technologies that use software, right? So our imaging equipment, other diagnostic equipment throughout our clinics that can give our physicians more insight into what the next phase for a patient is in their care journey with us. And then our job is to make sure that those technologies are, well maintained, they're up to date, they're up to speed, and they're not out of date, which sometimes is an ongoing challenge to manage.
Super interesting. So, I mean, it sounds like you're definitely the person that's trying to figure out how to connect all these tools, processes, and technologies together in a sort of seamless way to make it seamless for everybody in healthcare. So we definitely appreciate you doing that. But I do have some questions around it because we are at an interesting time. So technology is moving at a rapid pace. It's not slowing down, and it keeps on getting better and better and better and better until it becomes too good to ignore, right? And right now, I think that thing that everybody is talking about is AI and the role the role AI is going to have in healthcare. But we already have a large set of these existing systems. They might be siloed, they might not be siloed. So my question for you is, how do you see AI playing a role in this healthcare journey, per se? Sorry, that's a loaded question, but
No, well, you're talking about AI, so it's inherently loaded. AI is it is important, I think, to everyone to ask themselves, what do we believe AI can help us with? If you're really astute and aware of the challenges that you face on a day-to-day basis, hopefully as an organization, you write them down and then try to figure out how we can introduce AI to solve these problems. And I think that's sort of a strategic way to do it, as opposed to just jumping headfirst into the AI, um, fad. And because it could be a little chaotic, if you if you did it that way. And that entails embracing a culture of innovation, and that starts really at the top. Our CEO is very always looking at how to make things better. And she always says that very, very clearly. We have a new chief clinical and innovation officer. Well, he's not new, but the role is new. He previously served as chief medical officer, and he is really doing a phenomenal job at driving that culture that embraces innovation, that is tasked with answering the questions. What are the biggest challenges that we face right now as a healthcare system, and then how is AI going to help us solve those issues? Um, we have a culture of piloting here at UCSD, which I love, because if there's something that you want to try out that involves a new technology, there's a process to navigate that you could introduce a pilot, whether that's ambient listening or some sort of surgical software that helps provide new insights to surgeons as they're performing new techniques in the operating room, or old techniques, and telling them, hey, relative to, 1,000 surgeries that will perform that are similar to yours, here's some of the, some of the insights that could be beneficial to you in the future. I also think it's probably important to build an ethical framework around AI too, because a lot of people are skeptical about AI, Sal. A lot of people, it's not just healthcare; it's everywhere, right? It's going to take our jobs. It's going to, change. It's going to reduce the human aspect of service delivery. And those are real and very critical questions that everyone's got to answer. We've taken sort of a strong position that AI is going to enhance the care that we're already providing, and really augment the abilities of all of our employees and our physicians. But AI itself is undeniable. It's sort of like this tsunami that is going to affect all industries, right? And so if you don't embrace it and have a plan, you're gonna be behind. Even if you're a taco stand, even if you're a taco stand, you're using AI.
That is hilarious. Um, yes. Well, back to healthcare. No, but I totally agree. Yes, everybody agrees, and that's the whole realization that people are having, right? Is AI
Right.
is going to affect not just one department. It's going to affect nursing, legal, finance, everything that you've got going on will have some sort of connection to AI. And that is the transformation that's waiting to happen, right? So
Yep.
like I said, it's a very interesting time to be in, definitely right now. I would say there are a couple of really big issues. One of them might be a change management one, is figuring out, okay, how do we adapt to these new systems? How do we get people to change the way that they're currently working and get them to work in a different way that is more AI focused, that is more data focused,
Mhm.
because the data is the pretty much the lifeline to the AI at that point, right? So it's gonna kind of require some sort of shift if you want to go if you want to go the AI route, right? So my question for you, Ellington, is how do you see that happening or
Ooh,
rolling out?
very insightful, Sal. Very well positioned there. Um, it brings me back to a very fundamental question in human, in organizational behavior, knowing the difference between a technical challenge and an adaptive challenge. So, a technical challenge, in a nutshell, is something that it's a challenge you can change, whereas an adaptive challenge is you have to change the person's attitude and behavior toward what's coming. So for example, I remember as an intern, my first internship, the hospital was transitioning from paper records to electronic health records. And so I learned very quickly there's a big difference between a physician asking, I need help logging in versus I don't know how to use technology. I'm not good at technology, right? Those are two
Mhm.
completely different questions, right? And a lot of organizations struggle because they will, you know, uh, try to solve that second question of, I'm not really good at technology with a technical solution, right? Oh, well, we'll call technical support to come help log you in. Yeah, and that's not really how you solve that problem, right? It's got to be a strategic decision by the organization that this technology, whatever it may be, is our pathway to a better future. It's in alignment with our strategic vision as an organization to, and whatever our vision, whatever your mission is as an organization, typically it revolves around, being at the leading edge of clinical care and ensuring everyone who needs healthcare, we're there for them. Typically, it is somewhere around there. And is AI in alignment with that? And if so, how can you begin to dip your toe so that there are some wins that your team can go through to create some momentum towards adopting it? It's not going to happen, overnight. It's going to be, you know, several years in the making. Um, my recommendation would be, start small. Like for us, um, I'm really excited, for example, with just, patient scheduling, like being able to give patients faster, quicker ability to schedule their appointments with the right provider, with a provider that specializes in an area that they need, a condition that they have. Um, Clinical decision support, so whether that's, an AI powered tool that gives doctors insights and, while they're performing certain consultations or after they've gotten an imaging read, information about that read that the physician otherwise would have had to interpret themselves would be phenomenal to have. We also use a lot of predictive analytics where we have an AI model that forecasts volumes and different resource needs throughout the organization. So if we've got, patients that are holding in the ER, or we have patients that are queuing on the surgical schedule, or we have patients that are, coming in through some sort of telehealth consultation from a certain part of the region, um, and they need access to a downstream, service. It would be great to know that. And AI has been really helpful, and it's a way to kind of sample it a little bit and like build your appetite, like almost like an appetizer. before just diving right into the meal. And I think over the course of the next few years, um, everyone that works here will have been immersed in it enough to really be ready to make the change happen, you know? Um, so that's kind of what I would recommend, and that's kind of what I see happening right now. Um, but I will tell you, there are a lot of organizations out in rural America that really could use AI for a lot of things, and hopefully they get that opportunity.
Well, definitely. Yeah, it definitely sounds like this is something that everybody has to map out first, right?
Yes.
And
Yeah.
have a long-term kind of view of this and really pick out slowly what pieces you want to add AI into first, but it but you still got to have some sort of AI strategic thinking going on, or somebody to at least map everything out. That'd be great, I think, so for healthcare works. But what are the top three technological improvements that you believe would have the most impact for you in 2024?
Ooh. Um, this is another great question because I think it's like, what are challenges that we face as, healthcare leaders, and how can technology help? I would say the first one would be improve interoperability between a lot of our management systems. So if it's patient scheduling or physician calendars, where we need to know, are they doing a research project? Are they traveling to a conference? Are they in the OR? And matching that all together on one visualization would be phenomenal. And we currently, some departments do a little bit better than others in terms of the systems, but it would be great to have that. And I've seen some vendors, trying to come to the table with, how do we integrate all of these multiple different programs and softwares into one uniform, visual, so that we can get a good beat on, everything that's happening. I would probably say the next one would be just continuing to advance our data analytics tools, making them more sophisticated, making them more insightful, being able to provide recommendations as to other data that we should be looking at to make better decisions. Like I think about patient wait times, um, right now, as something that our patients have told us that obviously they don't like to wait. But when you think about, how healthcare is set up, um, it's very different from, let's say, a restaurant. A restaurant, your peak times are going to be probably Friday, Saturday, Sunday, right? But that's, and they staff up to that because that's when customers want to go to, um, consume those services at restaurants. In healthcare, we also have periods like that where, people maybe get off work and then, okay, no, let me stop by the ER. But from an elective standpoint, the availability is typically around our surgeons and our physicians. When our physicians are able to go to work and be in the clinic, that's when the availability is. And it may not always be when patients want to consume services. So we've had to really think about different ways to look at that data, to present it to our physicians so that they can sort of be more proactive in creating times that are more available to patients. That's just one example of using the, analytics differently. And the other one would be just really big in surgery is the AI powered surgical tools, which are whether it's robotics, embedded imaging systems that enhance surgical precision. um, we even had one software that uh, claimed to be able to, well, not claim, I think it proved that it could do it, record the surgery and then provide the surgeon real-time feedback as to, you know, the navigation process, how the surgeon is choosing to perform this surgery relative to hundreds of other surgeries of this exact same condition. Um, that's something that's really cool. Now, value is something that is another question. Are we going to get any improved outcomes and value out of investing in some of these enhancements? And that's the financial calculation to AI that everyone's got to do, right? Everyone's got to really, either you put aside an innovative budget to say, we just have this much to spend on innovation this year, or you really start to create a model that says we expect a return from the money that we're going to spend. Because healthcare systems, they don't have a lot of free cash flow. They don't have a lot of cash on hand to just sort of experiment. You've got to be very targeted and strategic in a lot of that work.
Wow, what an adventure. My concluding thoughts are that AI has a big role to play in healthcare this year. Implementing AI really well will provide the most impact out of anything. It was such a pleasure having you on the show, Ellington. I'm looking forward to having you on for future episodes.
Thanks, Al. Thanks, everybody.